Hello everyone, this is Dr. Tinuade talking about STI. If you have not subscribed to my YouTube channel, please do so. You can follow me on my Facebook page, Ajani Tinuade Shola, on Instagram, Ajani Tinuade. So today we are going to talk about human papilloma virus. Human papilloma is a virus and it has more than 100 types. And more than 60 types can cause genital warts. So today I'm going to talk about genital warts, not the cancerous one. Type 16 and 18 are known to cause cancers, but I'm not going to talk about them today. I'm going to talk about genital warts, which is caused by more than 60 types, but majorly caused by types 6 and 11. So what I'm saying is that human papilloma virus causing genital warts, they are caused majorly by types 6 and 11. And how do people contract them? It's mainly by sexual intercourse. By sexual intercourse or by format, which is rare. What do we mean by format? Format is when somebody that has the warts or somebody treating somebody that has the warts gets in contact with the lesion. They now touch maybe a surface, a bag, and somebody now come again, the person touch that area, the person can get infected. But this route is rare, but it occurs. Or then we can have through the birth canal, a baby can get infected, but most of the time when baby get infected, they come down with a respiratory problem because of the warts. So people can contract, but majorly people get genital warts by sexual intercourse. And how do this lesion, how does it look? It's like this growth, like a bump on the body that is painless, and it can be itchy. People scratch. In fact, some people scratch it to the extent that they injure that area. It can start bleeding. It can start weeping, or it can bring out crust. It's like cauliflower in appearance, and it can be small, multiple in sizes. Then you can see it in multiple areas in the body. What I'm saying now is that you can see it on the vulva and you see it in the cervix. Multiple areas in the body. You can find it in multiple sites in the body. You find them in different sizes. The color can be the color of your skin, or it can be the color, what we said, let me know. I said I'm not going to use much of medical, something like it's like blood is around this area. When you look at it, there is like a red, is reddish. You can see it like that in the body, or it's like the skin of your the color of your skin. And in male, you can find it on the glans, you can find it on the shaft. The glans is the head of the penis, so you can find it on the end of the penis, you can find it on the body of the penis. In females, you can find them mainly on the vulva. Vulva is the outside part. I've explained that before. The vagina is the inner side. You can find it in the vagina. You can find it in the vagina. You can find it on the cervix. It's there too. Genital warts can be in that area. In both men and women now, you can find it around the anus, peri area. You can find it in that area, especially for people practicing anal sex. You have it there. Then you can see it in the mouth, in the pharynx, in the larynx, the area that leads to the mouth, the area that leads to the respiratory area. Some people even say the trachea. So, but what we are saying, you can find genital warts in the mouth, especially for people practicing oral sex. It can even cause sore throats. So, human papilloma virus 6 and 11 can cause genital warts in the mouth. That's what I'm trying to explain. You find it in male, you find it in females. And we have subclinical infection, and this subclinical infection is commoner in male. So what I'm trying to say is this, that though both male and female, when they get infected, they have symptoms, that is, they have genital wart that we can see outside. They have the bumps, they have the cauliflower lesion. But when we have subclinical infection, it is commoner in male. That's what I'm just trying to explain. So it's possible for a male to get infected with the virus. They don't bring out any symptom. The symptom they bring out does not really look like genital warts, but those people can still infect others. That's what I'm trying to explain about genital warts. Then apart from that, genital wart too can cause bleeding after intercourse. I know that HPV 16 and 18 causing cancer, one of the symptoms is bleeding after intercourse. But for pregnant women, one of the reasons why they bleed during pregnancy is because of genital warts. And bleeding after intercourse too can be caused by genital wart that is traumatized. It's possible for somebody to have genital wart in the vagina, and during the process of sexual intercourse, the vigorous ones especially, you can bruise that area, that starts weeping and it start bringing out blood. That is what I'm trying to explain. And in a mother that is infected too, when they give birth to their babies, the babies can have genital warts. They can have also respiratory illness because of that. And genital warts recurrence is high. What do I mean by recurrence? I mean that if somebody have genital warts now, the person has it, is treated, it's possible for that person to come back in another 3 months. The person has it again, another 3 months. That's recurrence, as it's occurring more and more and more. So why do we have it? Number one, genital warts, I've told us, has a subclinical infection. Then it can have what we call latency. Latency is that the virus can be in the body and can be there for like 9 months without the person coming down with the warts. But when the person is immunosuppressed, the immunity in the body is reduced because of one reason or the other. The person will now start manifesting the warts. The warts will now start coming out of the person's body. That is what I'm trying to explain here. And that's one of the reasons for recurrence. Also, because that virus can be in the superficial layer of this, can be in the area of the skin where it's difficult for them to get removed. Let me just put it like that. So that's one of the reasons for recurrence. It can be deep. It's possible for somebody to have warts on the vulva and still has it inside the cervix, and they might not even know. They will just be treating the one on the cervix, and the person can get himself reinfected, that the ones even on the vulva might appear again, because our warts can be deep-seated. That's what I'm trying to say. It can be in the hair follicle, areas where you can't even, the intervention cannot get to. It can be in those areas. So that's why recurrence is commoner, and then because of immunosuppression. Somebody might have it, and the person is latent in that person, and everybody like, okay, and later the person is immunosuppressed, something happened, maybe they are pregnant, they get sick and like that, and the warts will come out and it will manifest. And one of the pointers to HIV infection is huge genital wart. I've seen genital wart that is very big as my hand. And genital warts can be small, can be moderate in size. But when you have a genital wart that is very huge, it's one of the pointers to HIV. In practice, when we see huge genital warts, those patients, we make sure we have to screen them for HIV, because it's been noticed that when people start having that kind of wart that is as huge, they are what? They are HIV positive. And there are treatments for genital warts actually. And before I talk about the treatment, let me just say some other things. Genital warts can be there for like 2 years and it will resolve on its own. It's possible. And genital warts can just cause the other place can be disfigured. And I've told you that the subclinical nature of the infection sometimes make it dicey, make it really dicey, because if it's subclinical, You might not even know. And the person can still go around to be infecting other people. And it's been saying that there can be malignant transformation, but it is very rare for type 16 and 11. For type 6 and 11. It is very rare. But for type 16 and 18, which I said I'm still going to talk about, those ones are the real ones that can cause cancer. Type 16 and 18. But I'm going to talk about them, but not today. Today is about genital warts. So if it's not treated, what can happen to it? It can stay for 2 years, it resolves. After it can resolving, it can come back again, and there can be recurrence. That place can be disfigured. Then there can be malignant transformation, although it is very, very rare. It is very, very, very rare to have that for types 6 and 11. So human papillomavirus is not something that is far-fetched. That's what we are trying to say, and that's why I'm talking about it. It's something that people have, and the age from like 17 to 33, that's like that age range. You see it more 17 to 33, but the peaking, as in the where the commoner, or let me not even say the commoner, the age groups that you see them more and more is that of 20 to 24. That's like the peak age. So we see a lot of young people in the hospital coming with genital warts, because at that age, people just want to experiment sex. So they practice a lot of unsafe sex, what we call unsafe sex. And I've said before that, genital warts can be in fact, can be around the thigh. I know I've spoken about that area, but can be around it. And it's even reported that you can see it on the extremity. That means you can see it on the hand, you can see it on the feet. Because somebody practicing inner sex, people that, some people do to fingering and some other things like that. When you do those things, you can have it on the extremity, your hand, your feet. Though it is rare, but you can find what's there. That is type 6 and 11. You can find it. You can find it on those areas, because sexual intercourse some people are vast in sexual intercourse, different method, different ways. So it's possible to find it on the extremity. I mean, your hands, your feet. You can find genital warts in those areas of the body. And that age, people have it. So if you have it, feel free to come to the hospital. You will get treated. It's better to get treated. We have different treatment modalities depending on the location, depending on the size. There are some areas that our chemical that we use, we don't want to go to that area, because if we use those chemicals in those areas, the wound will be more. The person can start bleeding. The wound might not heal on time. So that's another reason why we have recurrence, actually, of genital wart. That's another reason why we have it. But if you have it, come to the hospital. And if you have any questions, you can contact me on my Gmail, ajanitinoade, talking about STI 023@gmail.com. I will say that again, ajanitinoade, talking about STI 023@gmail.com. So till another time when we talk about something else. Bye.